Here are some normal things about breast you need to know. Number 1. They are never the same size. So if you have noticed in the mirror that your left breast is small or your right breast is small, that is normal. Asymmetry of breast, which means left and right are not equal. This happens with everyone. There is a slight difference in size, and this is absolutely normal. Number 2. Color of your nipples can range from brown to pink, and they're different shades. So if you are an Indian and your complexion is wheatish or brown, then you don't expect to have pink breasts like foreigners, which you have seen in adult content. Don't be ashamed. So in market you will find pink lighten lotions or pinkening lotions and all of that stuff. You don't need to use them. Many people are embarrassed of the color of their nipples and go for treatments such as laser, by which they can convert their brown nipples into pink. They're almost ashamed, and when there is no problem in that thing, then why you're trying to change it? Just own it and accept it. Number 3. Breasts sag with age. Just like wrinkles come on your face, the skin gets loose, the skin of the neck gets loose. Just like that, your breasts sag, and there's no problem with that, or you don't have to do surgeries for that. As long as you're not getting uncomfortable, they're not causing pain when there is no skin discoloration, it's absolutely normal. Sagging is just a part of aging, just like everything else. Number 4. Hair on breast is normal. If you want to remove it, that is very personal choice. But you need to know that any kind of hair around your nipple areola complex is absolutely normal. So the main difference between females and males is the testosterone or the androgen hormone, with which the quality and quantity of hair is decided. But if we compare the bodies, hair grows in the same spots on both males and females, but they are less dense and less coarse. But sometimes in some women, there can be androgen excess, or there can be sometimes when you are stressed out or your PCOS is not under control, this can lead to androgen excess and the hair starts growing more dense or more coarse. If it is happening all of a sudden and in excess amount, then you need to worry about it. Otherwise, it's normal. Number 5. Erect nipples. Inverted nipples are different than what you have imagined. Erect nipples happens in very normal situation like when you're aroused or cold or around your teenage or adolescent age. Nipples can stay erect for prolonged time and there is nothing to worry about it. Like what's happening or why is it happening? If you are feeling shy about it or just awkward about it, you can of course use a padded bra or a pad, but this is normal. Other than that, inverted nipples, many people have inverted nipples. There is only one problem with this. If you are a mother and you're breastfeeding, there can be a problem with the baby latching on, but that can also be dealt with. So don't worry about it as long as there is no discoloration, no discharge, and when there is no erected nipples and suddenly become inverted. So basically a major change occurs. As long as this doesn't happen, then it's normal. Stretch marks on your breast is normal. So sometimes you gain weight or sometimes you lose weight. Any fluctuations you get stretch marks, right? Whether it's on your tummy, whether it's on your arms or anywhere in the body. So breast tissues are 4 to 5 times more stretchable than rest of your body. So naturally, there will be stretch marks. Be you and own it. Number 7. The size of areola can vary from person to person. What is areola? The brownish area around your nipples, that is the areola. So it can be small or it can be large. If you have gained the weight and the breast size has increased, then the size of areola will also increase. If you are stressed or went into cold environment, then for some days it will appear that the size of areola is decreased. There is no need to worry. Also, some women have boils-like bumps on the areola. They are nothing but your sweat glands. The medical term for them is sebaceous glands. This is normal and there is no need to worry about it. Number 8. Breast pain. You should know when the pain is normal and when it is abnormal. Mid-cycle or during ovulation, when your breast feels heavy or pain, it will subside in 2 to 3 days. This is normal. Sometimes just before your periods, because progesterone is like when your lower abdomen feels heavy or aches, in the same way your breast can feel heavy and painful. But other than this, if there is too much pain, when you can't deal with it, discharge with pain, lumps with pain or discoloration, then that's not normal and show it to your doctor as soon as possible. So now that we have known what is normal about breast, so just because society has sexualized, objectified and made it a perfect image, so you don't have to be ashamed of whichever color, shape or size of your breast you have. You need to own them and love them just the way you love yourself.